intro to make sure that all works smoothly. Thank you, Dr. Bahadurandi, for the meditation session. I have the pleasure of introducing Dr. Bhavna Shamasunder, Associate Professor in the Urban and Environmental Policy Department at Occidental College in Los Angeles. Dr. Shamasunder teaches and conducts research on environmental health and justice with a focus on disparate and cumulative burdens for women of color and faced by communities of color and the poor. Her active research projects include potential health disparities for women of color from synthetic chemicals in consumer products, and the types of information used by U.S. immigrant communities in decisions to lighten skin and or use skin lightening products, and the health impacts from neighborhood oil drilling in Los Angeles. Her work is supported by the National Institute of Environmental Health Sciences, the California Breast Cancer Research Program, and the National Science Foundation. Today, she'll be discussing the environmental injustice of beauty data from the Taking Stock study, examining product use by Black women and Latinas. Welcome, Dr. Shamasunder.
Thank you. So if you are in the wrong breakout room, I'm sorry, you got sucked into this Harry Potter style, but if you, I think I know that if you leave and then come back to the Zoom, you can be replaced in the meeting room that you want to be. So sorry for the confusion, but I'm going to share my screen and let's see if I can do that. Do you all see a PowerPoint? Yes, okay. So I'm gonna go through the Taking Stock study, which is funded by the California Breast Cancer Research Program and the Passport Foundation, a portion of it. And I'm speaking on behalf of our bigger team, but our project is looking at consumer product use among Black women and Latinas with a focus in South LA, but I'll be presenting the California portion of our work. So how we came to this project, I think the morning session gave us a lot of information as to why we even started this project. So we know that women of color are disproportionately exposed to consumer product chemicals. And just to start, I'm gonna try to go for 15 minutes and I'm hoping we can have a conversation also. So there's a lot of data. So if I'm going through it quickly, I'll share my slides with you back. Some of them are charts that I hope you will be able to see, but if you have questions, just stop me and maybe flag Marissa and she'll stop me. So women of color are disproportionately exposed to consumer product chemicals, things we already know. We see higher levels of consumer product chemicals in the bodies, in national surveillance studies, in the bodies of Black women in particular. And we know, as the morning session told us, that a lot of these chemicals are endocrine active and are associated with hormone-mediated health conditions. So fibroids, preterm birth, diabetes, asthma, immunosuppression, and breast cancer. And so these are really downstream, very downstream measures of harm. So we only know chemicals are in people's body when we can measure them. We know people get sick when we can measure that. And so if we know these two things, we can ask the question, well, what are the sources of these exposures? And there's really very little data documenting product use, especially in diverse communities. So that's where our study starts. Before this project, or while this project was getting funded, my colleague Dr. Zota and I did a paper you may have seen called The Environmental Injustice of Beauty, really looking at how does beauty product use play a role in reproductive health and reproductive health disparities. And we were really interested in kind of moving that conversation upstream and thinking about how can downstream beauty rituals that may seem really normal, like this, my mom uses this and I use this, my community uses this product and I do too, how are some of these products actually linked with internalized racism, but that actually originate with structural racism. So structural racism is really things like policies and dress codes, targeted advertising to women of color, cultural norms, and peer pressure. An example of a policy or dress code is the military banned particular hairstyles that Black women would use if they were not gonna straighten their hair. So these are things like braids, and if you can't naturally manage your hair, you have to use a chemical straightener. And so these levels of codes could be one factor, but we also see targeted advertising. And so those of you who follow the Johnson & Johnson case on talcum powder see this, that talcum powder was really sold to all women, a sprinkle a day, keeps the odor away. Generations of women sprinkled talcum powder in their underpants. We see large levels of cervical cancer and ovarian cancer, but the question is why, and there's some work on internalized racism, some good historical work looking at odor discrimination, that Black women really were subject to a lot of odor discrimination that questioned moral standing. And so women began to use a lot of homemade douching products that then became a part of what mothers would teach their daughters to do if they wanted to be safe in this society. So we need to think about downstream uses. A lot of work really has spent a lot of time just measuring health outcomes and exposures, and we want to really think about what are these racialized beauty norms and what how do they even drive purchasing. And so we're interested in the chemicals that are linked to these adverse health outcomes. So we in our paper thought a lot about back we will go, what the products are. And here's an example of some of this work that you may, the product you use may be a skin lightening cream. This could have mercury in it or hydroquinone. And this leads to toxicity. Parabens, we've talked about early this morning, has been linked with fibroids and breast cancer. Phthalates, talc powder, right? We see links to gynecological cancers. So if you actually move sort of upstream, you know, who are the vulnerable populations that are targeted. We do see disparate marketing, but you know, the more you want to change your body, the harsher the chemical that you need to use is to get there. So straight lightening your skin is no small matter. But the issues are not simply downstream individual health consequences, but the fact that that these have material and economic benefits, right? If you have lighter hair or straighter, lighter skin or straighter hair, there's data that women make more money, women and men actually have better economic outcomes too. So they're not only health outcomes, but economic outcomes that also are health related, and it can be circular. So who's our team? This is a team for the Taking Stock study. Marissa used to be at Black Women for Wellness, and she left our team to go to Harvard, but she's still a part of our close-knit circle. I'm a co-PI on this study with Jan Robinson Flint, who's the executive director of Black Women for Wellness, and as you can imagine, she's really busy during this time. And then we also have a team on the ground, a team of promotoras who are community health workers led by Sandy Navarro, who is also the director of LA Grit Media. And I'll show her video, that outreach video she did for our study. Robin Dodson at the Silent Spring Institute, and Betsaida, who joined us later, who we had to farm into the picture, and then the George Washington School of Public Health, and Karen Michaels, who's a breast cancer epidemiologist, is an advisor to our study. So we're a big team. We're also working on a project that we hope can give us some good data on that is community-based. And as we discussed this morning, empirical data collection is really hard work. People don't do it because it's time consuming. They'd rather rely on a secondary data set. It requires a lot of trust building in communities that are overstudied, but under considered, right? There's a lot of factors that go into community-based research. So our aims are to examine racial and ethnic differences in personal and cleaning product use among 600 premenopausal women in California. We are characterizing the perceptions, accessibility, and the use of these among particularly Black and Latina women. We're really interested in South Los Angeles, which is where Black Women for Wellness is based. And it's known by the state of California to be an environmental justice neighborhood. So we'll ask the question, are EJ communities differently affected on consumer products? We know that environmental justice, place-based exposures, big factories, freeways, point source pollutants are worse, but what's happening in communities that are described as EJ communities around personal care products? And then we are also looking at, we're going to test the products that the women are using. and look for estrogenic activity. So this is our little picture. We are really on aim 1 and starting aim 2. We're just at the beginning of starting aim 2. And so I'm going to share data from our survey of product use in California. So we did a survey of across the state of California looking at product use. We're asked all women across all racial and ethnic categories what products they used. And we collected 600 surveys in California. And I will talk about a subset of these, but what did we ask about? We asked about the whole gamut. So cosmetics, vaginal genital hygiene, personal care products, cleaning, pest control, their self-identification by race, their occupation. And so there is no validated survey questionnaire that we could just use. No one has done this level of kind of research on products. So we created our own, but we used past survey questions. Black Women for Wellness has asked questions with their community. Silent Spring has done a lot of work on this nationally, and Amizota works on fibroids, and so she has questionnaires. So we work together to create a questionnaire. We have a community advisory board made up of California Latinas for Reproductive Justice, Black Women's Network, and Communities for a Better Environment, and they gave us input on our questions. We tried it out with Black Women for Wellness community members. And then we did a lot of footwork to do our study. It is a lot of work to get 600 studies completed. And so we reached out to our networks. We did community organizing events, and we did a lot of outreach. And so women, and Black Women for Wellness's offices are really located in South LA. In LA, we had good coverage. And then we also had a lot of outreach. They have an office in Stockton. So as you can see, we are representative of the entire state. This is our 600 surveys come from these areas predominantly, although we do have Central Valley and very Northern California representation. But I do think that it's, you know, we wouldn't call it a random sample across California. It's really a community outreach effort to get women. What I think is notable in our sample, we actually have many more Black and Latinx women of all ages because we are targeting outreach in these communities, right? So in future years, we'd like to think about Asian communities more, and when we have funding to do that. Although for this sample, we did get a lot of data in Asian and white communities. Marissa, can you give me a 15-minute marker when I'm there? Okay, yeah. So I'm presenting data for, what'd you say? Yeah?
We just hit the 15-minute
We just,
mark.
okay, I guess I'm gonna have to keep going. Tell me in like 4 minutes, yeah? Okay, so our, this data in 18 to 34-year-olds across all races and ethnicities. We had 73 Black women, 102 Latinx, 51 Asian women, 79 white women, and we had a really big number, a good number of multiracial women. So women, we didn't stick into one bucket or the other, but really have to start asking the question, how can we better do research in multiracial populations? And these were all done through the kinds of organizing I just described. So what are people using? So women reported using an average of 8 cosmetics, 5 hair products, 2 hygiene products, and 10 other personal care products currently or within the past year. And maximum of 10 cosmetics reported per day. So if you see this note, you can see that the total products include other products also. So this is across all women, across all races and ethnicities, including multiracial women. But then we broke the product categories out by race and ethnicity. In here, we don't actually include multiracial women, and it's data that, you know, I'd be curious how you all are sorting out things that you're thinking about, but they don't go into a bucket. It's, I think, literally, we've decided it was kind of problematic to try to put a woman who's Black and Latinx in the same bucket as someone who's white and Latinx, but they also, what bucket do you put them in? Do you put them in Black or put them in Latinx? And then you're double counting. So right now they're not represented in this. We have a separate graph, which I'm not going to show you today because it's still really complicated, but you can see the total number of products in each category. So for feminine care products, you see that Black women use more cosmetics overall, and fewer feminine care products. And then hair products and other personal care products. So you, this is kind of a nice graph of sort of the overall differentiation by use. So this is looking at just cosmetics. And so here we can kind of follow the line and ask, and these are, and what is presented here is only data that we found some sort of statistical significance for. So you'll see something like setting spray is used much more often in the Latinx community. It's also used most often by Black women. And then you can follow it down. So powder, rouge, baking powder makeup, which I didn't know was a makeup, but was named by many Latinx women as something they use. Nail polish was broadly used, eyeshadow, concealer, not as much. So you'll see kind of down the line the kinds of differences we found. So here, if we look kind of more specifically at hair products, you'll see that all women report using shampoo. But you see differences when you look kind of within products. So pomade, grease or wax, more Black women use. Hair glue for extensions and weaves, more Black women use. But, conditioner, you see more white women use, and co-wash, you see more Black women use, right? So we are trying to look at, what are people using, and is this going to help us unravel some of the exposures? Because women are using a lot of products every day. So sanitary napkins, right, all women use. But vaginal wipes were more broadly used by Black women. Vaginal washes, more broadly used by Black and Latinx women. White women use the menstrual cup. Black women use douching products more often. And Asian women used anti-itch cream more often than other women. So in feminine hygiene, use of products not related to menstruation was actually less common overall. 11 women reported using feminine sprays or douche in the last week. And then half the products varied by race and ethnicity. Black women reported greater number and of different types of hair products compared to other women. And then more Latinx women reported using lipstick or other lip compared to Black and white women. So I'm going to, in the interest of time, sort of tell you, move kind of past the other things, but we found some of the same patterns across all of these. And what does that mean? What are we going to do with this data? We're thinking about frequency of product use. So how often are women using these products? And then we're looking in particular for hair products. You'll see that hair gel, for example, is used more than once per day by not an insignificant number of women, but then some women, use things very rarely. So we're looking at percentage of users. And then I'm going to skip past this too. And so we did this, if you want these graphs, and so you can stare at them for a while because it's hard to see on a screen, I will share them with you. I wanted to show you fragranced products. The majority of women report using fragrance products. With 60% products and the disclosure that's coming down the pike. So this is a broad look at to use our Taking Stock app, and they will scan all the products. Can you hear me, Marissa?
Yeah, you were breaking up a little bit. You're
is that
at
better?
9 minutes too, just
okay.
For a time check.
They'll scan all the products in their house, And then for 7 days, every time they use a product, they'll let us know what product it is. And at the end of the week, we'll get a urine sample. So we're going to be doing biomonitoring. I'm going to show you the video that we are developing. Can you see? You can't see that. So I'm going to stop share here. And I'm going to share here. And if it doesn't work, okay, here. Can you see that? Can you see that? No?
No, you can't. Yeah.
No, you can't see it. Here, let me try again. Okay. Now, okay. Okay, I'm going to play it. It's 30 seconds and then I will take questions. Can you hear it?
No, I don't think we can hear it.
You can't hear it? Okay. I don't know why you can't hear it, so I will try to stop it. Oh, what a pain. I don't know why you can't hear it. This is a problem with, okay, so you'll have to watch it on your own time. I will try to.
Sometimes there's a checkbox at the bottom when you're sharing your screen that you have to check to share your sound.
Let's see if I can do that. Okay. Oh yeah, you're right. Here it goes. I'll try one more time. I'm sorry, it's so dumb.
I know we're all trying to figure out Zoom.
Okay, here we go.
My name is Jan Robinson.
Except it stopped.
Flint. I'm the executive director of Black Women for Wellness. Thank you for taking part in our Taking Stock study. The Taking Stock study is a community-driven research project. We have partners. It's Black Women for Wellness, it's Occidental College, Silent Spring Institute, LA Grit, and the most important part of this project is you as our community. So we're looking at how Black and brown women use chemicals. What are those products that we use are toxic chemicals, and how those products impact our health. The average person uses 26 products every day. This is just my walking around stuff. I didn't bring the bathroom with me, but we use a lot of products. So what we're asking you to do is scan in your products, your lip gloss, your lipstick, your hair care. Thank you so much for participating in our study because it couldn't be done without you. And it's important because we need to know about our health and well-being.
Okay.
For the next 7 days, you'll be using the Take.
Okay, I'm going to stop sharing it. So that is our, that is of the video. We are onboarding participants. Primarily in South LA. So if you know Black women living in South LA who might want to participate, we are interested in hearing from them. And we are still, so we're just starting. We had to take a break because of the COVID situation. We couldn't collect people's urine and other kinds of things in person safely. So we are now starting up again. And this is our list of funders, California Breast Cancer Research Program and the Passport Foundation. And I know that was really fast and we only had 30 minutes, but I will, I wanted to stop so I could take questions if anyone has any in the last 5 minutes.
Yeah, does anyone have any questions? Please feel free to unmute yourself or message me. I already have a list of questions, even though I've worked with Bhavna for quite a few years, but I can definitely start off if no one else has anything. I'll wait a second.
You can also just unmute yourself and ask. But one of the things that, yeah, we're thinking about is how do we inventory the kinds of products that women use? We don't have one. And if we don't have an inventory of product use, how do we actually protect women and inform them about any of the exposures that affect their health? And so in the next phases of our project, we'll be having people scan their products, we'll take a urine sample, but one of the other things we'll do is get their products tested, because there's not a lot of disclosure of what's actually in the product. So if you find it in your body, the problem with that is that you don't know what you used to have it get there. And so one of the things that go along with it is actually collecting the product data itself. And so given the extent of gaps in chemical policy, the fact that beauty products and consumer products have just been left out of landscapes of environmental protection and public health, leaves women exposed, and we see that women of color are most exposed. And I think Black women really lead kind of our benchmarker of our exposures. And so the other project I work a lot on is skin lightening creams. And we actually, it's a huge market. It's a $6 billion market in skin lightening creams. And we actually see a lot of Asian women, a lot of Indian women use skin lightening creams. And the question is why, how do they learn about it, and what happens when they use it? And some of the things that I'm really interested in that we don't have great ways to get it are, what are the mental health tolls that these kinds of product use take? How do you make those choices? And just using it, and then the health effects beforehand, how can we include kind of the mental health side? So.
We have a question and a comment. First, the question or the comment: critically important research. Thank you so much. We'll share the information with others.
Thank you.
And the question is, how are you accounting for the proprietary ingredients that product makers won't disclose?
Yeah, we can't. These are really hard. I think the largest proprietary ingredients tend to be fragrances because they're protected by trade secrets. So I think with the policy kind of efforts, we are able to, learn as we learn more about fragrance, what's in fragrance products. That's helpful, but I think accounting for them is hard. We have no way to do anything except for the chemicals that we know about, right? We know about the things that we're testing for in products are phthalates, phenols, and parabens are the 3 categories that we'll test products for. But you're right, the whole array of things that we can't test for.
Do we have any other questions? I can ask one of mine. I'm kind of curious, just in your experience, what were the largest barriers that you've encountered so far in this project?
That's a really good question. It's, I think there's a lot of work to be done on community education on this issue. And women, are interested in telling you what their products they use, but they also want something back. They want to know what to buy that's better and different. And that's a really hard question because there's not always better and different products. And so there's Black Women for Wellness. We rely on a lot of their materials on, using fewer products, using products without fragrances, limiting your product use, and those kinds of things. So I think organizing is hard. And I think that's why a lot of research just skips that step. And I think it's an important one that we shouldn't skip.
A good answer. We're coming to a close, so thank you so much for the work that you've been doing, and I know we're all going to be want to keep up to date on this project, and I think the website is takingstockstudy.org. Did I remember that correctly?
Yeah, takingstockstudy.org, and then we have a paper coming out with the first phase of this soon, and I can send it out, and I can also share my slides. I'm sorry they were dense and hard to see. It's a lot of information, but thank you for coming.
All right, we'll see you all back in the main session really soon.
Yeah. 1 second.